Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and for today, I am here with Dr. Millicent Rovelo. How are you doing, Dr. Rovelo?
I am okay.
Good. Are you just okay?
I'm just okay.
Well, it's,
It could be worse.
it could be worse, right? I think it's because we're talking about thread lifts, because they're just okay.
Yeah, they're just okay. So thread lifts, right? What are thread lifts? So this is not new. This is not new technology. This has been around for decades in various iterations and forms. But the basic premise and idea is that you have threads, literal threads, made of dissolvable surgical material that are inserted through little tiny poke holes somewhere in your skin, and they're threaded under the skin, and they have these little barbs kind of that make them sticky. And you put them where you want, right up against the skin, and then you give it a tug, and all of a sudden you have this like lift from wherever you've put it. And I've seen people do it in various body parts, the stomach, the knees, whatever. Breasts, yeah. So the idea is that like you are lifting the skin using this internal suture type device. Sounds cool.
Yes.
Sounds great. No surgery needed.
Sounds easy.
Yeah, it's scarless surgery. So what's the problem?
I don't know that there are problems. I don't know that there are problems. I think the problems are that,
Well, okay, let's talk. Well, let's explain a little more.
Okay.
So these materials, these threads, are made of an absorbable material, so they're not permanent.
See.
They absorb. Oh, that's yes in Spanish for those who don't live in Southern California.
I just kind of say that now.
I know, me too.
See.
Por supuesto. But the sutures absorb over the course of about 6 to 9 months. And so over the course of about 6 to 9 months, the results go away as the sutures dissolve. So in a way, it's similar to fillers, which also go away theoretically in 6 to 9 months, or the results of it do. So it's not designed to be a permanent solution. And I think that is the first thing I would like to address, is that if you're going to do these kinds of procedures, you can see a result, but you have to know that it is not a permanent result.
Yeah, the issue that comes up is that, it's like when we go to do facelifts on people who've had threads, there are some scar issues. And so you said scarless, but it's not scarless.
Yeah,
because it does create some scarring, and it's unpredictable scarring.
Yeah.
I don't mind people getting thread lifts. I mean, people always say, I'm going to get some threads and it's going to look great. And, and it's not cheap.
It is not.
No, that's the thing. It's not cheap. It's not like, $1,500 or whatever. No, it's like $6,000, $7,000, $8,000, $10,000, who knows, depending on who's doing your threading. But it looks good when you do it.
Assuming it's done well.
It's kind of like doing finger surgery.
Right.
It's like, why can't I just have this?
I just
want this.
I just want this.
Yeah, and, okay, give me a stapler,
Now, it's not as dramatic as a facelift.
No.
It's not going to be exactly like the finger surgery that you do in the mirror where you like pull to the moon. It's not going to be, I know I do that all the time now. Well, just tuck it back here.
Here, give me the stapler. Or how about like a safety pin?
Yeah, exactly. Can you just pin it back here? So it's not going to be the dramatic surgical result, but it is going to be an improvement. There is going to be a little bit of a lift and a redraping of the skin. But yeah, it's not cheap, and it's not permanent.
And facelifts aren't permanent either, but they... facelifts last. When you get a facelift,
they are not permanent because they respond to aging and gravity.
Of course.
Threads are not permanent because they dissolve.
Yeah. And it's not a permanent move of the structures.
Yeah.
It's just you're pulling them into a different position, sort of scooting them over themselves, folding them or imbricating or tugging, whatever. The thing that I've seen, and it wasn't always absorbable sutures, by the way.
Right.
They used to use permanent sutures. They were like Proline.
And then they learned.
And then they'd like come out of your eyelid, or I saw crazy stuff like sticking into the nose. They would migrate through the tissue and like wind up, coming out in your mouth and stuff like that. It was weird. So they stopped with that and they went to absorbables, and that's good. And their PDO is sort of the material that most of it's made of.
Right.
I don't do them.
I mean, I don't do them either. I don't think most of our PAs do them. It's an option. It's something you can do I think if you are in definitive facelift category, like you come in and it's like you needed a facelift yesterday. I don't know if threads are the right option for
No,
you.
in that situation, they're actually not a good
They're not a
option.
great idea. If you were in that mid facelift territory, like you don't quite need a facelift yet, but you are seeing some signs of aging, then, honey,
I know. No, it's too late. No.
No, this is not your category.
Oh, damn it. Damn it.
No, you do not get threads.
Fine, whatever.
But the younger person who's not quite ready for a facelift or just isn't quite ready to commit to the facelift, it's a good temporary option. It might hold them over until they are ready to do the facelift. But I think if you are in the definitive facelift category, this is not for you. That being said, there are people who will never get a facelift. It's just not for them. They don't want to have the surgery. Well, you can give it a whirl and see what it does
It's a lot of
for
money,
you.
by the way. You know, these things ain't cheap. None of
not
it is.
cheap.
Plastic surgery is expensive. Like that is it's not cheap, you know?
It's not.
You know, especially in Beverly Hills, but like even anywhere.
Right.
You know, there's nothing about plastic surgery that is inexpensive.
And by the way, nor should it be. I mean, how many times have you and I like taken care of people who went to go get a deal somewhere on super cheap plastic surgery and they have really big problems? Like this is actually the one expenditure that you don't want to go like thrift shopping for. Like plastic surgery is expensive for a reason because the people that do it and do it well, you know, their expenses are high and they're good at what they do, and so they should charge appropriately.
Right. Not everybody has to go to Beverly Hills or New York or Miami for their plastic surgery.
There are brilliant plastic surgeons across the country.
That's right. You can get great plastic surgery in almost any city. There's some board-certified plastic surgeon there who's been trained and knows how to do this stuff, and they're the guy or the gal in town that does that, and they're good at it. With that said, in those markets, I'm sure that the plastic surgery prices are still expensive for that market.
For that market.
You know, it is.
Right.
It's like we're not going to sit here and say like, oh, it's going to be cheap. If you go from New York to Toledo, Ohio, you may find the facelift to be a lot less expensive, and you could find somebody really good there. Who knows?
But their overhead expenses and their rent and their cost and their employees, all that is less. So there's reasons why it's less or more in certain geographic locations. But
where do the threads fall?
I'm not sure how we digressed into that.
Well, because we're talking about like, are you going to get a facelift? And that's why threads come up so much, because people are like, I can just do this thread lift and it's $7,000 or $8,000. And I'm telling you, that's a big driver of it. This is where, like, I don't know if any, like, I know the plastic surgeons who are, you know, sort of my vintage and probably yours, remember the lifestyle lift.
Mm-hmm.
Like this was a big
the
to-do.
lunchtime lift.
No, the lifestyle lift was a very significant company that came and went bankrupt. And the concept was that they were going to do a little skin excision, maybe a couple of smash sutures under local anesthesia in the office, no anesthesiologist necessary, and it was going to be like $8,000. And it's a facelift light. It's some sort of, and they could add the neck for $1,200, whatever. But it was cheap plastic surgery, commoditized, done by whoever they could get to do the cutting. It really wasn't done by a lot of plastic surgeons. I remember they gave a big contract to, I think Malcolm Paul was sort of their chief medical officer guy, because he's a facelift guy around Newport Beach, and they led the charge. And I honestly think that it was lifestyle lift that got everybody interested in facial aesthetic surgery a lot more, even though the company went bust because they couldn't get enough practitioners. Their model didn't work, and you know, you can't have like ER docs learning to do facelifts. It just isn't. It's just not a good idea. Like, then that's what they did. They tried to get any Tom, Dick, or Harry to do the work and charge their commodity pricing. So it went down in a ball of flames.
Right. But even with like a light facelift, you can have complications if you don't know what you're doing, if you don't know where you are, if you don't know your anatomy. Like if you're not skilled in facelifts, like you don't want just some like.
No, they cut the facial nerve on a bunch of people. I mean, it was terrible. There was a reason it didn't last.
Yeah, that's not great. So we get it that money is tight, that is an issue. My recommendation is, if you know yourself and you know that you are going to want to have a facelift and budget and money is tight for you, then forego these other things for now and just save your pennies. Save those $7,000, $8,000, or whatever you might spend on these non-invasives, and just wait an extra couple years until you can afford that facelift, if you know that that's what you eventually want to do.
if you want it.
Yeah. If you're like, no, I'm never going to want to have a facelift, so I'm going to do these. But just like we referenced, know who it is a good candidate for. The younger patients who still have good skin quality, who have expectations about what they can and can't achieve. If you are 70 years old, if you are a massive weight loss patient and your skin is no tone, is not tight, is falling down, even if you're in your 40s, threads are not for you. They're not going to help. You're going to throw the money away. And if you're okay with being marginally happy after spending that amount of money, then fine. Great.
Yeah, I mean, the practitioners, which is not just, and I never like the term
Practitioner.
Provider. Like, I got an email the other day, and this is a little sidebar. It's going to chap your hide, I can tell. They wanted me to sign up with them to be one of their lead providers on findaprovider.com or whatever it was. Basically saying, like, we're going to, like, level the playing field between nurses, PAs, doctors, estheticians, whoever doing these procedures.
Whoever's providing care.
Whoever's providing the care. And I sent them back. I said, this looks like a noble business that you're going to, but I didn't go to provider school. And
I went to doctor school.
Yeah, I did. I got an MD and I went to medical school and I think there's part of it that's like, so who's doing your thread lift? It's like, it's a provider, and that may be a doctor, but it could be a nurse. It could be a nurse injector. It could be a nurse practitioner. It could be a PA. In some states, it could probably be an esthetician.
It probably could.
In some states. In California, pretty much you need a PA, a nurse, or a doctor to do this stuff. So, and I don't want to knock any, because I have PAs and nurses, and they're amazing at what they do. But when you're getting a thread lift, of course, the provider is going to say, it's going to be awesome. Of course you need this. But, it's kind of up to you. Like our PA, in Beverly Hills, and also Christina, too. I mean, Orla and Christina, these two amazing physician assistants are so careful about recommending stuff that isn't going to work. They will not do that. They will only say, yes, we can do this. Yes, some filler. Yes, some lasers. You know what? You got to go talk to the surgeon. Like, we're done here. So, like, getting somebody that's going to, not just take your money, because, of course we all want to look better. And because we all want to look better, if you ask somebody like, hey, can you do this for me? They're going to say, sure, of course.
Yeah.
So having somebody that's willing to say, you know what?
Not for you.
This is where we hit the wall with what I can do. You need to go to the surgeon. And Orla and Christina have been pretty amazing with that, and that's a plug for the Rock Spa, by the way. So, those are amazing people. But in your area, wherever you are listening to this, and people do listen to this podcast around the world, try to get a sense of whether your person, whether it's a nurse, PA, or whatever, a doctor who's doing this, dermatologist, plastic surgeon, otolaryngologist, I don't care. Whoever's doing this for you, internist who decided to make some extra money doing some, there are people that pick up aesthetics because they like it, and it does pay some cash, so people like that. But make sure that they have that aesthetic eye, and make sure that they have an understanding of when to say when.
Yeah, I think I've said this before. If you're going for these non-invasive procedures done by usually non-surgeons or non-doctors, it really is in your best interest to choose one that is affiliated with the doctor's office. I would say a surgeon's office, but obviously there are dermatology offices out there that do that. Sure. But those are going to be the providers, practitioners.
But you can say they're providers at that point, because now you're lumping everybody together. So that's the key. But the only reason I take exception to that is like the insurance companies and
the insurance companies. They want us all to be the same.
They want us all to be providers, because it's a way of cutting us down. They don't have any.
They don't have to pay us
regard
more.
For expertise or whatever. They think that whoever they hired is to
equivalent.
It's just not that way.
Yeah, it's an insurance thing. But if you are going to a med spa associated with a plastic surgeon or ENT or surgeon's office, those PAs or nurses are going to be more likely and more honest with you about when you need a surgery. They're going to try and do everything they can for you non-invasively because, of course, that's what they want to do. But they're probably going to be a little more likely to refer you for when you need surgery because they're within that practice. Versus if you go to a standalone med spa, which is only making money by doing these procedures over and over and over again, they have no incentive. They have no reason to tell you that you're not a good candidate. So that's why I personally think that you should go to one associated with a doctor's office than just a standalone place where they really just want to take your money.
Well, and they want you to keep coming back.
And keep coming back.
You know, it's like the therapist who never wants you to get better.
It's so true.
Why would they want to help you get better? They want to just keep talking to you.
Yeah.
I'll see you next week. I can see you next week.
Yeah.
See you next week.
I don't know. You've made adequate progress.
I'll see you next week. We're going to see you next week. Yeah. I mean, so it's like the same thing. But with aesthetics, this is why we always do the concept of the aesthetic plan. You have to have a plastic surgeon. Again, this is something I learned long ago when people asked Sophia Loren. This was when I was like in high school. Sophia Loren, how come you look so great? She's like, oh, it's simple. You find a great plastic surgeon, you get old with them, and they keep you looking great. And that's what you should do. You should have one person that you go to. The people that mix and match and go around, and this one does this, that one does that, they wind up looking weird.
Yeah, they get a little Picasso-ish.
They do. They get a little bit of disjointed aesthetic look because you got too many cooks in the kitchen.
Too many cooks in the kitchen. But yeah, I think that's sort of it for threadless. Just wanted to talk about them versus surgery. Surgery is obviously going to be a more dramatic, longer lasting result, but it is a surgery. It does have downtime. It is more expensive. Threadless, less of a result, but it doesn't really last. But
if it's enough for you,
it's
right. So
an option.
Get the information. We're not. I don't think thread lifts are a bad thing.
Well, okay. So I will say, because we actually have a whole podcast about a patient that had a bad thread lift experience. So there are different kinds of threads.
Oh,
the threads that we are talking about right now on this podcast are these threads that are designed to sort of lift the skin. They go in, they're long. They have like, I don't know how many they put in to lift the brows or lift the cheeks, but they're designed to lift the skin. Apparently, and I'm not familiar with this, but this patient had like these mini threads placed, which are designed almost to act like a filler, to literally create scar tissue, to plump up and create volume in the soft tissues of the face. And she struggled, and her words, destroyed her skin. So I would maybe stay away from those little mini threads if they are offered to you.
If you want to listen to that was the Kimberly Cates episode. She was, one of our amazing actress friends who wanted to talk about it because it really
she wanted to talk about it.
It destroyed her. It really hurt her. Yeah. We got her looking good with some little
she
modifications.
Ended up getting a facelift.
Yeah, we got to do a little mid face for her.
Yeah.
She looks good.
Yeah.
Yeah. For those of you who don't know who Kimberly Cates is, she was one of the princesses in a very, very long ago movie, Bill and Ted's Excellent Adventure, which you should check out. My kids watched it, actually. They were just we got to watch that if it was from your time. I said, that's when I was in college when that came out, actually. Yeah, it was kind of cool. That was one of Keanu Reeves' first movies.
Yeah, it's like breakout hits. Yeah.
Yeah, it was good.
Excellent.
But love you to death. I don't know if you've watched it yet, but this movie with Keanu Reeves, for those of you connoisseurs of Keanu, check this one out. You will not be disappointed. Kevin Kline, great. Tracy Ullman, what a great movie. Anyway, that's us on Threads. I think that's all we have on that.
I think we've maxed out.
Yeah, we won't be doing it in our office, but you can come and get a mid-facelift. We'll be happy to help you with that.
Happy to accommodate.
In that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.